dry eyes to vision issues, just a few consumer complaints after patients underwent laser eye surgery. And get this, there's concern that some patients weren't clearly looped in on the risks of that procedure. The executive editor of the Puget Sound Consumers Checkbook, Kevin Brasler, is here with a deep dive into what happened here. Kevin, good morning.
Good morning.
So what did you discover some providers may overpromise patients when it comes to laser eye surgery?
Yeah, well, that's the concern. There's growing worry that it's not just surgeons, but the device manufacturers themselves aren't necessarily fully disclosing to patients the risks of having this procedure. And also, a lot of surgeons often overpromise in terms of, they say things like, well, this will be a permanent fix. You won't have to wear eyeglasses or contacts anymore. And with most patients, that's not true. Most people who get LASIK, at some point later on in their lives, will still need to wear either readers or have another surgery done to maintain 20/20 vision. But the big concern is that patients just often aren't fully, informed about, the side effects from this procedure. It's true, and I'm not here to really, cause a lot of scare among people who are thinking about getting this procedure. I mean, the risks of serious complications like loss of vision or significant loss of vision, very low. I mean, this is a very safe procedure. It has been since it was approved by the FDA in 1999. 20 million Americans have had it done, and there are very few reports of having serious complications. But there's growing worry that a significant portion of people who get LASIK have small nagging problems, so much so that they wish they hadn't had the procedure. And as you mentioned, Bill, a lot of those problems are, blurry vision, painful eyes. Dry eyes is a huge problem among people who get LASIK. Those problems persist, as far as we can tell, in terms of the studies we've seen. As many as 40% of patients who've had LASIK still have those problems 5 years down the road, and a fairly small percentage of them, about 10% of that 40%, it's a big enough problem to where they wish they hadn't gotten the procedure at all.
Are people generally happy with the long-term results with LASIK versus folks that aren't?
Yeah, I think overall people are happy. They're glad they got the procedure done. I think that too many consumers don't realize that down the road they're still going to have to wear glasses, which was the whole point of getting the surgery to begin with. But a big problem is that, it's about, we're not sure because there's not enough hard data on this, but somewhere between, 5 to 10%, are somewhat reluctant to agree with the fact that they're glad they got the procedure at all. And there's a small percentage of people who got the surgery who wish they'd never had it because they still have problems like dry eyes many years later. And so what the FDA is doing is they're drafting recommendations for the device manufacturers especially, to make sure patients are fully informed about the risks, to make sure patients understand that, hey, a lot of people who get this procedure do have these nagging problems down the road. And also, it's not necessarily a permanent fix for most people who get it. Again, they still need to wear glasses down the road. They cannot correct the fact that your eyes are going to age over time, and you're likely going to need to wear readers or get another surgery to maintain 20/20 vision.
Are there some red flags that we should be looking for when we're selecting a LASIK eye surgeon?
Well, I think that if the surgeon doesn't spend a lot of time with you and doesn't have enough time to answer your questions, that's a big red flag. I mean, one thing to look for when selecting a surgeon, really any surgeon, is whether or not they give you what's called enough chair time. Do they rush you through any questions you might have? Make sure you're getting answers to your questions. I often recommend you take a family member along to help you take notes, write questions in advance. A key thing to ask a LASIK eye surgeon is whether you're a good candidate for LASIK, because not all of us are. Some people, just the shape of their cornea or their vision requirements in general means that they're not good candidates for LASIK. They may be good candidates for a different type of surgery. And if so, make sure that the LASIK surgeon has a lot of experience in those other areas. And finally, I'd say shop around. And we contacted all the eye surgery, laser eye surgery places in the Puget Sound area. And for a single vision correction, both eyes using LASIK, we were quoted price differences. The lowest cost was $3,200, and the highest price surgeon was more than $5,000. And because in general, it is important to find a skilled surgeon, but in general, these procedures are safe. I think it's worth, asking surgeons that have high costs, why are you so much more expensive than others? Because a lot of the costs for this procedure are paying the royalties out to the device manufacturers.
That is great insight. The executive editor of Puget Sound Consumers Checkbook, Kevin Brasler, thanks for your time. Appreciate it.
And good to see you.